Now then, we move on to talk about the upper limbs. The upper limbs being the shoulder, the elbow, and the hands. Now that's what we call the upper limbs. So for the shoulder, certainly there are two main common causes of shoulder pain. Number one is that tendon inflammation or tendon pathology. That's the common problem. Second problem is the shoulder capsule. We first talk about the shoulder tendon, first of all. Now then, there is a tendon that runs underneath this piece of bone called the acromion and is right immediately above the shoulder. Now this often moves and there's a scrape along the undersurface of this bone known as the acromion, resulting in inflammation or a partial tear to the tendon.
所以我们现在来看一些最常见的就是肩膀的一个疼痛的一个部位，然后我们才来看其余手部的一些问题。所以其实影响到我们肩膀的疼痛有分成两大种，第一种就是我们筋的一个问题，然后另外一种就是关节的一个问题。所以我们首先来看一下会导致我们筋发炎的一个问题。所以在我们的肩索那里其实有一个骨头，就是常常跟我们的筋摩擦，所以当摩擦久的时候就会导致那里急促的发炎，然后如果我们不去处理的话，这样就会导致那里的筋部分撕裂，然后如果再不去处理的话就会完全的撕裂。
So usually the condition progresses on from acute inflammation to moving on to partial tear and may deteriorate to a complete tear. So it's important that when patients do have shoulder pain, that they need to treat this at the early stage in order to prevent it from getting worse. And that, so most of the times during the acute inflammatory stage, it's important to arrest the problem.
所以很多时候，当病人就是有这些肩膀疼痛的部位，就是感觉到非常疼痛的时候，最重要的是先给他先消炎，所以然后多多休息，因为在我们早期去处理这个问题的话，会比我们在延期到当它退化到完全撕裂会比较好处理。
Because whilst during the early stages it's easy to treat with medication and sometimes with injection, whilst if there is a complete tear, then one may require to treat this surgically, which involves in stitching up the actual defect.
所以，因为在我们早期，就是当它还在发炎的一个情况下，我们给一些消炎药或直接在那里打消炎针的话，其实就会有很大的帮助。因为如果不去处理，导致它完全撕裂的话，这样可能我们需要开刀把那个撕裂的筋缝补好。
Well, luckily that nowadays we're able to repair the most of these tears with keyhole surgery. And the keyhole surgery does involve in a very small wound, and much of the operation is actually done by looking at the television, and with this we're able to repair most of the tears.
所以幸好，如果是需要做手术的话，其实因为现在科技这么的发达，我们就是只需要开一个非常小的洞口，就是把显微镜放进去我们的肩部的一个那个地方，然后就可以直接在我们的显微镜那里直接把那个筋缝补好。
Now then, the second most common cause of shoulder pain is called adhesive capsulitis, or otherwise commonly known as frozen shoulder. Now then, frozen shoulder is a condition that affects the capsule. The capsule is what surrounds the two bones, and that is inside of this. In this condition, it becomes very much inflamed. And subsequently, then there's increasing deposition of scar tissues inside, resulting in stiffness to the shoulder.
所以另外一个会影响到我们肩部疼痛的，就是我们的关节那里。所以这个就是当我们的肩膀的关节那里急促的发炎的时候，这样就开始首先病人去感觉到非常的疼痛，然后如果不去处理的话，这样其实那里就会造成很多的组织停留在那里，然后再不去治的话，就会感觉到非常的僵硬。 然后手就不能举过我们的肩膀。
So with these conditions, many of the patients are not able to rotate their shoulders or bring their hands up above their shoulders, or as you can see here, many of the patients may not be able to reach their back.
所以很多时候，这个冻结肩就会大大的影响病人的活动范围。很多时候就是不能把手举过肩膀啊，或者是不能把他们的手就是靠他们的背部，就是活动范围大大的减少。